Okay, so we are picking up where we left off with our next body system. So we're moving on to chapter 18 today. And chapter 18 is infectious diseases affecting the cardiovascular and lymphatic systems. So this is chapter 18. All right, and this is just a picture that we have looked at before that shows the anatomy of the cardiovascular and the lymphatic system. So the cardiovascular system, like we talked about before, is meant for circulating red blood cells and oxygen through your body. Your lymphatic system is mostly meant for circulating white blood cells and other immune components. So your lymph system has a lot to do with the immune system. Your circulatory system has more to do with circulating oxygen and other products throughout your body. But the lymphatic and circulatory systems are both parallel systems. There are a series of vessels that travel all the way through your body to all of the different tissues within your body. Both of these systems, as they are naturally, are what we call closed systems, which means that there's no actual natural portal of entry or portal of exit. The only way that things get into the circulatory or the lymphatic system is by crossing membranes, which they can do, but it's more difficult. There's no natural opening to the blood or lymph systems, circulatory or lymph systems. So they're both naturally closed systems. And as far as is known right now, there is, in either of these systems, there is no colonizing bacteria. So I would say no normal flora. Now, don't take this to mean that bacteria never get in there. Bacteria do get in there from time to time, especially in the lymphatic system, as your body destroys them. But most of the time, any bacteria that does enter either of these systems is going to be very quickly destroyed. Other notable parts of both of these systems, the cardiovascular system has your heart. That's how the blood gets pumped throughout your body. So your heart is attached to your cardiovascular system. And then also in your lymphatic system, you have these little, they're not quite organs, they're nodes called lymph nodes. And lymph nodes are collections of tissue where white blood cells go to destroy organisms and collect and do other things that have to do with the immune system. Okay, but lymph nodes are just collections of lymph fluid, basically. They're little tissues that collect lymph fluid and white blood cells. And we'll talk about lymph nodes quite a bit because there's a few infections that infect the lymph nodes. Now, the tricky part about the circulatory and lymphatic systems is both of them are closed systems with no natural normal flora, and they're very, very difficult to enter. It's pretty hard for a bacteria or virus to get past all of the epithelial cells, all of the chemical defenses, all of the mechanical defenses, past the mucous membranes, past the vessel walls, past the endothelial cells, into the bloodstream. That's a very difficult journey. However, if a bacteria or virus or parasite or anything else does manage to get past all of those defenses into the circulatory or the lymphatic system, the truth of it is that your circulatory system covers your entire body. And so if something does manage to take up residence and start multiplying in either your circulatory or your lymphatic system, it very quickly will spread to the rest of your body. Right? It's not the same as like getting an infection in your lungs. Like your lungs, if you get an infection in your lungs, it's usually going to stay there. But if a bacteria manages to get into your bloodstream, it quickly causes what we call a systemic infection. And systemic means throughout the whole system. So this basically means your whole body. So if an infection becomes systemic, which it usually does when you have blood and lymph node infections, it very quickly can spread through your whole body and start affecting all of your organs and everything in your body. All right, so the first disease that we'll talk about is septicemia. And septicemia is another one of those kind of collections of diseases that can be caused by lots of different bacteria, lots of different viruses, lots of different parasites. All kinds of things can cause septicemia. But septicemia by itself is a generic term given when microorganisms are actively multiplying in the blood. So you have an infection. That prefix, emia, means in the blood. Okay? So you can actually have bacteremia, which means you have bacteria in the blood. You can have viremia, which means you have viruses in the blood. Okay, you can have fungemia, which means you have fungus in the blood. But septicemia is when you have microorganisms actively multiplying in the bloodstream. The biggest signs and symptoms of septicemia are fever and chills. Those are the biggest early ones, and just generally feeling like garbage. So a person who has septicemia, they will have kind of this global feeling, terrible feeling. Every part of their body will hurt. They can have joint aches and pains. They have a debilitating fever, chills that won't stop, and just the idea their entire body is sick. It's not something like, oh, it burns when I go to the bathroom, or my arm hurts because I have a wound on it, right? It's this, their whole body is sick. And then the kind of hallmark symptom that's associated with septicemia is low blood pressure. And this low blood pressure is also called septic shock. And we use that term shock. We use that in our language pretty frequently. It has a lot of different meanings, right? You can shock somebody, you can scare somebody, kind of means shock, or you can electrically shock somebody. Shock means a lot of different things. But when we use it in medicine, shock means that your blood pressure is dropping dangerously low. And the reason that happens is because of this. So bacteria enter the bloodstream, and the immune system responds to fight the infection, right? And the immune system is going to talk to each other with cytokines, and they're going to do all kinds of things. B cells are going to be activated, T cells are going to be activated. But remember that one of the key things that happens in inflammation is that you get leakiness of the blood vessels. The blood vessels get bigger and they get leaky so that those white blood cells can get to the tissue to fix the problem. Well, that's fine when you have a cut on your arm and you have local leakiness of your blood vessels and it makes your arm turn a little red. But when that happens in every single blood vessel in your body, because your whole body is sick, it will drop your blood pressure very, very dangerously. And what that means is your body, your tissues, your organs are not getting enough blood. The pressure of your blood is not high enough. Okay, so your organs won't be getting blood, your tissues won't be getting blood. And what can happen with septicemia very, very quickly is that because the organs are not getting enough blood, they fail. And the organs stop working, and this can very quickly cause organ failure and death. Septicemia is a very, very dangerous condition, mostly due to that septic shock, which is the incredibly low blood pressure due to the full body immune response. Now, causative organisms for septicemia, there are not particular organisms that are known for causing septicemia. The characteristic of septicemia is that it's usually caused secondary to another infection. So septicemia, for the most part, does not occur by itself. You don't have a perfectly healthy person who one day gets septicemia. What usually happens is you have a person that gets pneumonia, which is an infection in your lungs. And then the bacteria become so prevalent, there's so much bacteria in your lungs that they manage to get into your bloodstream and then cause septicemia. Or you have a urinary tract infection and the bladder and kidneys become so full of bacteria that the bacteria spread to the bloodstream and you get septicemia. Or you have a wound infection that hasn't been treated, or you have a sinus infection that's not treated, or anything else. Okay, so there's not a particular set of organisms that cause septicemia. Septicemia is usually caused secondary to another infection. So the trick with this is, what is the initial infection? So I think the question yesterday or the last time we met was, what bacteria is known for causing soft tissue infections? I think most of you got it right. What is it? Staphylococcus aureus. Staphylococcus aureus is known for causing soft tissue infections. So if I tell you that a patient has septicemia secondary to a soft tissue infection, their septicemia is most likely caused by Staphylococcus aureus, because Staphylococcus aureus is what caused the initial infection. Okay? And the thing to remember is that any bacteria that causes infection in a human body is capable of causing septicemia. You can get septicemia secondary to gonorrhea. You can get septicemia secondary to an eye infection or an ear infection or pneumonia or a UTI or food poisoning or anything else. You can get septicemia secondary to any other bacterial infection. Okay, so there's not a particular causative organism that causes septicemia. It's just important to remember that it's secondary to other infections. It's what happens when other infections are either not treated or the treatments aren't working. Our next infection is endocarditis. So itis, remember again, means inflammation of. Cardi means of the heart, like cardio, doing cardiovascular, doing cardio workouts. That means of your heart. Cardio workouts work your heart muscle. So endocarditis is inflammation of the inside of the heart, the lining of the heart. All right, and this is a picture of what a normal, healthy inside of the lining of a heart looks like. And then here you can see those big yellow, kind of pussy looking things. That's all bacteria that has taken up residence inside of this heart. So there's bacteria growing inside the heart. Now, endocarditis is not a very common infection. It's pretty hard to get endocarditis. But there is a couple of risk factors that makes it more likely. So transmission of endocarditis, we'll talk about that in a second, but it is most common So it is most common in people with pre-existing heart conditions. So anybody who has scar tissue on their heart, like anybody who's had a heart attack results in scar tissue on your heart. Or people that have unusual anatomy because they were born without valves, or valves that were poorly shaped, or valves that don't work well. Anybody who has had any kind of heart surgery, anybody who has a pacemaker, anybody who has had anything done or anything wrong, structurally abnormal about their heart, is going to be at much higher risk for getting endocarditis. It seems that like the abnormalities in the scar tissue make it more likely for the bacteria to get there. Okay? And the organisms that cause endocarditis, I'm not even going to write out all their names because you don't have to know them. But the organisms that most cause endocarditis are a group of bacilli, so a group of rods that are called Haychek bacilli. And that each stands, the HACEK stands for the genus of a different organism, but I'm not going to name them all. You don't have to know them either. All you have to know is that collectively, endocarditis is most caused by Haychek bacilli. And Haychek bacilli are, I put NRF there to stand for normal respiratory flora. So it's bacteria that is normal in your mouth and throat. Normal respiratory flora, NRF. Okay, so the causative organisms are a group of organisms called Haychek bacilli that are all normal respiratory flora. So how does endocarditis happen then? Most people who get endocarditis, again, typically have a pre-existing heart condition. So some kind of work done to their heart or a structural difference or something different about their heart. And it most often happens through tears in the mucous membranes in the oral cavity. Because when there are tears in the mucous membranes in the oral cavity, that Haychek bacilli that normally takes up residence in our mouths can get into the bloodstream through those micro tears in the oral cavity. And those tears in the oral cavity can be from something as simple as brushing your teeth too hard. Okay? It doesn't commonly happen to anybody who has not had something wrong with their heart previously. Again, those two things kind of have to be true for endocarditis to happen. The person has to have a pre-existing heart condition, and they have to have some kind of tear in their mucous membrane. And this is such a thing that, so my father-in-law, when he was about 40, he has a genetic condition, and he had a heart attack when he was about 40. And he survived, and he's alive, and he does great. But even today, so he's had heart attacks in the past, which means he has scar tissue on his heart. Because of that, every time he goes to the dentist to have any kind of dental work done, even just a simple cleaning, he has to go to the dentist a week beforehand and get antibiotics. And he has to be on antibiotics for the week before his dental appointment to prevent him from developing endocarditis. And that is true for a lot of people who have pacemakers or pre-existing heart conditions, that when they go to the dentist or anything that's going to be happening in their mouth, going to the orthodontist or things like that, they have to be on antibiotics ahead of time to prevent them from getting infections. Because the correlation between pre-existing heart conditions and dental work is so high with endocarditis. That is how most cases of endocarditis happen. And he actually had to have more extensive dental work done recently. He had to have kind of dental, I wouldn't call it surgery. I think he had to have like a root canal, which most of us, root canals aren't fun, but you go to the dentist and they numb you up, they give you some nitrous oxide, right? It's fine. He had to go to a real surgical suite, and he had to be put to sleep because they wanted it to be sterile. And they put him on antibiotics. They had him on IV antibiotics while he was having the procedure done because the risk of endocarditis is so high. All right, our next one, and if I didn't make that clear, sorry, I think I did, but these are all bacteria. I'm putting B for bacteria. So Haychek bacilli are all bacteria. Okay. Our next one is plague, also known as black plague or the black plague. That is our next infection, and plague is caused by a bacteria, again, a bacteria, called Yersinia pestis. And there are a lot of different forms of plague, 3 major ones, but we're only going to talk about 2. And the 2 major forms of plague that we're going to talk about is bubonic, and that's the word that's kind of associated with plague that we talk about the most, is bubonic plague or black plague. And it's called bubonic plague because what this bacteria actually does is it travels to the lymph nodes, and it has a really dangerous capability of being able to replicate inside of human white blood cells, specifically inside the lymph nodes. So lymph nodes are supposed to be kind of a hub for your immune system. It's where your white blood cells take bacteria and viruses to die, right? They all travel there, and the lymph nodes are what digest them and get rid of the bad things. But Yersinia pestis has the dangerous capability of being able to grow there. Okay, so the white blood cells will phagocytize the bacteria and then carry it to the lymph nodes, thinking that that's where it's going to be destroyed, and the bacteria actually takes over and colonizes the lymph nodes. Okay, so the main symptom of bubonic plague are these incredibly swollen lymph nodes. And those lymph nodes, you have inguinal, that's the fancy word for lymph nodes in your groin, But you can also have lymph nodes under your armpits. There's a lot of lymph nodes. You have a lot of lymph nodes right here underneath your neck. But those lymph nodes become incredibly swollen. And actually what will happen eventually is these swollen lymph nodes will die and they'll become necrotic and turn black. And those swollen, black, necrotic lymph nodes are called buboes. Individually, they're called a bubo. That's the name that's given to them. And so that's why it's called bubonic plague. Now, septicemic plague, as you might guess, septicemia is when you have bacteria in your blood. So septicemic plague is when that bacteria manages to make it into the bloodstream, usually after going to the lymph nodes first. It then manages to get into the bloodstream and causes a very, very deadly infection. And it causes that intravascular coagulation, which we talked about last time when we talked about meningitis. And that intravascular coagulation is when all of your blood clots inside of your body. And when all of your blood clots inside your body, those little clots inside your blood vessels block blood flow to the rest of your body. So what can happen is this. It'll block blood flow to parts of your body. Parts of the body that do not have blood flow will die and become necrotic and turn black. Okay, so that's kind of the characteristic symptom or sign of septicemic plague, is that intravascular coagulation, which leads to death of extremity tissue. In this case, it's the hands, but it can also be the feet or the nose or anything else. Okay. So bubonic and septicemic plague. And plague is transmitted through vector transmission, specifically through fleas that bite infected mammals. So there's actually 3 different parts to this equation. The first part is the human that's being infected. The second part is the flea. The third part is the mammal that's carrying the illness. Okay, so what happens is a mammal, usually something like a rat or a squirrel or a possum or some kind of mammal. It can also be carried by rats or by skunks and foxes and things like that. But usually it's associated with rats and squirrels and other rodents. So the fleas bite the rats that are infected, and then they go on and bite a human, and they pass the infection from the rat to the human. So the fleas themselves are not really infected. They're not a host. They're just the vector of transmission. Okay, so the fleas get the bad rap usually, but most of the time plague is transmitted through the mammals. It's through the rats. And so when the Black Plague, right, there was a huge pandemic in around 1300, and like a third of the world population, 30% of people in the world died of plague. Okay, it's horrifically deadly. Its mortality rate is very high, even still. Septicemic plague has an almost 100% mortality rate, even if it's treated. So it's very, very deadly. And the reason that this happened was because at the time, there was so many rats living in close proximity to humans. And so the fleas would bite the rats, and then the fleas would bite the humans because they all lived close by. And it caused the spread of this disease. Nowadays, people tend to not live in close proximity to rats and fleas. We have pest control options for that. But plague actually still exists. A lot of people think it doesn't. Does anybody know where plague grows in the United States, where it's endemic? Has anybody ever been to the Grand Canyon? They tell you about it there. So in the United States Southwest, so in the warm areas, the squirrels and things in the Grand Canyon and in the Southwest carry plague. There's actually stories, and I don't know how this is true, but I think it's fun to think about, that when you go to the Grand Canyon, if you've never been there are signs everywhere that tell you not to feed the squirrels. because the squirrels have been around humans their entire lives, and they will 100% hop in your lap and take food from your hand. But they're known to carry bubonic plague. And so there was a story, and again, I don't know if this is true or if they just tell it to scare the tourists. I don't know, but it's fun to think about. Is that there have been stories of people who were like hiking down to the bottom of the Grand Canyon and got bit by a squirrel and had to be airlifted out because the risk of bubonic plague is so high. Like, can you imagine being the person that has to be airlifted by helicopter out of the Grand Canyon because you were dumb enough to try to feed a squirrel? Don't be that guy. I don't know if it's true, but again, I think it's funny. So in the Southwest United States, in the Grand Canyon and parts of California, Arizona, and New Mexico, plague still exists. And if you get bit by a flea or a rodent in the Southwest, you do stand a chance of contracting plague. If bubonic plague now, however, now that we have antibiotics, if you contract bubonic plague, it's usually pretty treatable if it's caught early enough. So that's why they tend to treat people who are bitten by squirrels and stuff like that pretty aggressively early on. Because if you treat it early, you usually have a very good chance of survival. Okay. Our next one is tularemia. And tularemia is more commonly known as rabbit fever. It's called rabbit fever because it's a zoonotic illness spread through rabbits. And it can be spread through any type of being around rabbits. I actually read in your textbook, I didn't know this before I read it in your textbook, which is crazy to me, is that it's highly, highly, highly contagious. There have been people who have gotten tularemia because they ran over a rabbit and like went outside their car and were close enough to a dead rabbit that they breathed in the bacteria and it infected them. Okay, that's wild. There are not a lot of things that are that contagious. So you can get tularemia from just being around rabbits, and this is particularly wild rabbits. Like pet rabbits don't usually get this. They're not in places to get it. But if you hunt rabbits or skin them, eat the rabbit meat, anything like that, or you get bit by a rabbit, you're around one that has been run over by a car. Your book also told a story about people who've gotten tularemia because their dog caught a rabbit and they like removed it from their dog's mouth, and that gave them tularemia. So it's incredibly contagious. And signs and symptoms of this are ulcerative skin lesions, which can look a lot like that. So they're just little skin lesions. But kind of the hallmark here is the extremely swollen lymph nodes. So you can see right there, this is on the side of somebody's neck, and one of their lymph nodes in their neck is so swollen, it looks like they have this giant bubble sticking out of it. And tularemia, once it spreads to the lymph nodes, it very quickly can spread to the rest of the body and cause multi-organ failure, particularly respiratory failure, which means that you can't breathe. Your lungs don't work. It can cause respiratory failure. It has a very high mortality rate, even if treated. It has a 30 to 40% mortality rate. Okay. So again, it's a zoonotic infection passed through rabbits, and it's highly, highly, highly contagious. Treatment for it is IV antibiotics. Again, because it has such a high mortality rate, it does need to be treated very aggressively. Okay. And our next one is cat scratch fever. Now, cat scratch fever is caused by another bacteria called Bartonella henselae. And this has very, very similar signs and symptoms. Extremely swollen lymph nodes, respiratory, not failure, that's the wrong word, I'm sorry. Respiratory illness. Okay, but the difference, and so this one up top, this is under somebody's armpit. You can see how swollen that lymph node is in their armpit. They actually have two, they're swollen on the bottom too. And this is the bottom of somebody's neck, so right here. The difference between cat scratch fever and tularemia, these are both zoonotic infections. They both cause very swollen lymph nodes. The biggest difference is that cat scratch fever is usually very mild. You get these swollen lymph nodes that can be very painful, but typically it's what we call self-limiting, which means your immune system is going to kill it off. So most people who get cat scratch fever don't have any long-term consequences. It's very unlikely to cause death, and it usually goes away on its own. Okay. So treatment for this is usually oral antibiotics or nothing, depending on whether you go to the doctor or not. Because again, it's one of those things like you might have swollen lymph nodes for a day or two, and then you get better. So you may or may not go to the doctor. So you might have none. Okay. So those are illnesses that are similar in some ways, but very different in others. And cat scratch fever is also caused by bacteria. I can't remember if I said all these. These are all bacteria. Francisella tularensis is a bacteria, and Bartonella henselae is also a bacteria. I tried to group them together. All right, I think our last bacterial illness, pretty sure. So this is a bacterial illness, is Lyme disease. And Lyme disease is a bacterial illness caused by a bacteria called Borrelia burgdorferi. Borrelia burgdorferi. And the signs and symptoms of Lyme disease are early on, so some early symptoms is something called a bullseye rash. And this is a picture of the bullseye rash, right? That looks like a bullseye. There is a fancy name for it. You don't have to know what it is. All you have to know about it is the bullseye rash. However, something that's kind of become more obvious in recent years is that not everybody gets a bullseye rash. So the bullseye rash is kind of the hallmark sign that we all are trained to look for. But a bullseye rash, I think I read in your textbook, is only present in like 20% of cases. So not everybody who has Lyme disease gets a bullseye rash, and everybody who gets it, the bullseye rash is not visible. I think that there's a very famous episode, not a famous episode, but there's an episode of the show House where this person has Lyme disease and they're trying to figure out what's wrong with them. They can't figure it out. And they keep coming back to Lyme disease, but they're like, well, it can't be Lyme disease. She doesn't have a bullseye rash. And then they shave her head and she has a bullseye rash underneath her hair. Bullseye rashes are not always visible. If somebody has one on their back and they're not looking for it, or in their groin areas covered by hair and they're not looking for it, you may not see it. And sometimes it's not there. Now, the late symptoms of Lyme disease. So the early symptoms can be a bullseye rash and then some non-specific kind of flu-y-like symptoms. Late stages of Lyme disease. So the thing about Borrelia is that it gets into your body and it will divide and multiply for months. It's a very slow progressing disease, and it can take months and months and months and months to experience any kind of symptoms. But when they do strike, there are a lot of symptoms that have to do with the cardiac system. So there's a lot of heart problems, like chronic heart issues, where like their heart won't beat correctly, they have chronic low blood pressure or chronic high blood pressure, all kinds of stuff. But chronic, long-term cardiac symptoms. They can also have long-term neurological symptoms and long-term debilitating arthritis, which is inflammation of your joints. Now, the thing about Lyme disease that can be really, really tricky is that Lyme disease is very difficult to diagnose because it takes place over long periods of time, and a lot of times these symptoms can be signs of lots of other things, right? Non-specific heart palpitations, like your heart has a weird rhythm. That could be so many different things. It could be that you're going through menopause, or you have a thyroid condition, or the possibilities are, or you have anxiety. The possibilities are numerous, okay? And then there's a lot of different things, and blood tests are not very accurate. So the thing about Lyme disease is that a lot of people who have Lyme disease actually suffer for months and months and months with these debilitating heart symptoms, neurological symptoms. Their brain starts to get foggy. They start to have a hard time remembering stuff, things like that. And then they'll have this debilitating, incredibly painful arthritis that sometimes makes it impossible for them to walk. Sometimes people can't work. And a lot of times, it's just the state of medicine as it is right now. A lot of times people with Lyme disease will actually get originally diagnosed with like mental health conditions. Like you just have anxiety or you're depressed or things like that, because a lot of those symptoms do overlap. But it can be really tricky to diagnose Lyme disease. Transmission of Lyme disease is vector transmission through tick bites. So the ticks are the carriers of Lyme disease, and they transmit it through animals, usually like forest animals like deer and elk. So anytime there are ticks in wooded areas, things like that, they're at risk for carrying Lyme disease. And Lyme disease is actually a pretty common infection in the United States, particularly the south and eastern United States. So there are ticks that carry Lyme disease in Louisiana. So always check yourself for ticks when you come home from walking outside. Treatment for Lyme disease is usually oral antibiotics. If it's treated, treatment is usually very successful. But like I said, sometimes people will go months and months and months without being treated for Lyme disease because the symptoms can be hard to pin down. All right, next we have hemorrhagic fevers. And this is another group of organisms. So all of these hemorrhagic fevers are caused by viruses. They're caused by different viruses. You don't have to remember the different names, but hemorrhagic fevers is a collection of diseases. Some of the diseases in that category are Ebola, Marburg, dengue, and yellow fever. And the signs and symptoms associated with these hemorrhagic fevers is extreme fever, right in the name, has extreme, long-lasting fevers. So like 105, 106, 107 degree Fahrenheit fevers. And hemorrhaging. Hemorrhaging is just a fancy word for bleeding. Okay. Sometimes the bleeding is more internal for some of these, like it will cause bleeding in your brain or in your lungs or in your organs. And sometimes, like with Ebola virus, the hemorrhaging is very, very external. So people who have late stages of Ebola virus will bleed out of every orifice they have. Their nose, their eyes, their ears, their anal openings. There will be blood coming out of everywhere. And transmission of these is vector transmission through mosquito bites. And it can also spread person to person. So if a person has, so if a person has a hemorrhagic fever, they can spread it to somebody else through body fluids, which is really unfortunate because especially with things like Ebola, in the late stages of Ebola, it's really horrifying to think about, but literally somebody will have body fluids coming out of every orifice of their body, and they can't control it. They're just bleeding everywhere. And so the people who are taking care of them are very at risk for also getting that virus because they are coming in contact with their blood all the time. Okay? But it's mostly spread through mosquito bites. Now, the thing that is kind of scary and interesting about hemorrhagic fevers is that hemorrhagic fevers were actually like a low-level kind of threat in rural areas confined to Africa. So it was like small communities in Africa. There would be these tiny little outbreaks where a couple people would get sick, and then that would be it. But in 2014, we saw the first worldwide outbreak of Ebola. And in that one, there was a huge outbreak in urban areas of Sierra Leone and Liberia, which are both countries in Africa, but it also spread to the United States because of travel. And in that particular outbreak, 14,000 people died in one outbreak. And so Ebola is actually kind of one of those diseases that most of the infections that we talk about, right, like plague used to be a much bigger problem than it is now. It used to be a really big problem. It used to kill lots of people, and then we figured out how to deal with it, and it's less of a problem now. Ebola is the opposite. Ebola used to be less of a problem, but it's actually becoming a much bigger problem as time goes on. And there's a very real reality where if it is not controlled, that it could become a worldwide pandemic situation where Ebola is spreading everywhere. And the reason that it is thought that Ebola is spreading so much is because of global warming. Because it's spread through mosquito bites. Mosquitoes live in warm environments. As the entire earth becomes warmer, those mosquitoes are able to migrate to areas that they didn't used to be able to live in. So this is a map that shows the current living zone of the mosquito that is known to spread Ebola. But as even our country warms up, the areas that are further north, places like Wyoming and New Mexico and North Dakota, become warmer. The mosquitoes, this is something that we're already seeing, is places that didn't used to have mosquitoes ever, now have mosquitoes. And as the mosquitoes are able to spread to different parts of the world, so will the diseases that they spread. So Ebola is one of those that's kind of an emerging threat. Did you have a question? No, so humans are as far as I know, humans are the only vectors. So mosquitoes spread it, but they carry it, and the mosquitoes carry it. Mm-hmm. So as far as I know, there's not another host. It's mostly just humans, but they spread it to each other. So there was the biggest outbreak was in 2014, ever known of Ebola. There were other outbreaks in 2018, 2019, and 2020, but those were a lot smaller than the 2014 one. But it's possible that we're on the upswing of Ebola, and Ebola is just going to keep getting worse. Treatment for Ebola is mostly supportive care, and the other hemorrhagic viruses is mostly supportive care. And most of these have an almost 50% mortality rate even when treated. So they're very, very deadly. People don't survive them very often, especially people in places where these diseases are more common and they don't have a whole lot of health care. So somebody living in a rural area of Africa is not going to have access to a lot of supportive care like we would in the US. There was kind of I don't know how famous it was, but there was a story, I think it was I don't think it was the 2014 one. Maybe it was. Anyway, there was a case in one of the 2020, 2018, 2019, of a doctor who had traveled to Africa to treat patients with Ebola and, went into the line of fire and really put himself at risk treating these patients and caring for these people. And then he flew home to Texas and got Ebola. And it was kind of a state of the healthcare system worldwide that most of the people that he treated in Sierra Leone died. Like almost 100% of them died. But he came back to the United States and got treated and survived. I'm not saying that he shouldn't have been treated, but it's just it just shows the difference in the area. That the places where these diseases are more common and are causing the most deaths don't have the ability to treat them. They don't have the money to treat them. They don't have the resources. Right. So our next disease is HIV or AIDS. And this is another one that's caused by a virus. And the virus is called human immunodeficiency virus, or HIV. That's where that term comes from. And early symptoms of HIV attacks the immune system. That's what it does. So early symptoms are going to be generic symptoms, kind of fever or flu-like, just I feel tired kind of generic symptoms. But late stage HIV has systemic destruction of the T cells. So that HIV virus inserts itself into the T cells and destroys them. So as a person with HIV, as their disease progresses, usually over many, 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 many years, they will have a systematic decrease in the number of T cells that they have. And when it gets to a certain point where there comes a time when somebody who has advanced stage HIV that they literally count the number of T cells they have. Like you can count in their body the number of T cells that they have left. It gets into single digits, and then they have none. Okay, and that results in immunosuppression. If you don't have T cells, your immune system's not going to work. Those T helper cells are the ones that get activated first, and they activate everything else. If you don't have those T cells, the rest of it's not happening. And that, the level of immunosuppression is what we call AIDS. So AIDS is the syndrome, and AIDS stands for acquired, meaning that you got it from somewhere else rather than like an inherited one. Acquired immunodeficiency syndrome. Okay, so that is basically the point of an HIV infection when you no longer have a functioning immune system. And people who are infected with HIV eventually, at some point in their lives, will progress to what's commonly called full-blown AIDS, which is kind of a weird term. But they will eventually progress to where their immune system no longer works, and they will be considered having AIDS. Okay, so AIDS is the syndrome. And usually people who are infected with HIV and progress to AIDS usually die of some kind of secondary infection. So it's not the actual HIV that will kill you, it's the fact that you no longer have an immune system. And so people who have advanced AIDS often die of common colds or the flu or something else because they get infected with something and have an immune system that doesn't work. Okay. Now, transmission of HIV is transmitted directly through blood or breast milk. It is not present, or it is present in very small amounts in sweat, urine, saliva, stuff like that, but it is not known to be transmissible through those. So the only way, and HIV is not known for surviving very well outside of a human body. So usually the only way that it is going to be contracted is through direct transfer of blood or body fluid from one person to another, okay? Through either blood or breast milk. And you can see up here, and I know this is a topic that nobody wants to talk about in class, but we gotta talk about it. So you can see up here how HIV is most commonly transmitted. And these are I think these statistics are from like 2019. I think that's right. But in the male population, HIV is most transmitted through male-to-male sexual contact, okay? And the reason for that is two reasons. The first one is this is very often a sexually transmitted disease. It can be transmitted sexually. It's direct contact and direct exchange of body fluids. Now, it can be prevented by using condoms and barrier methods of protection. Men who are having sex with men, there's nobody with a uterus in this equation, and so men who have sex with men tend to use condoms less. Not always, but less. Because there's no risk of pregnancy, sexual contact between two males typically less includes condoms, which makes the risk of transmission a little bit higher. The second reason, and again, this is where it's gonna get a little weird, but we gotta talk about it. The second reason is that vaginal tracts are built to have penises go inside them, right? Vaginal tracts expand. They are meant to have penises go in and babies come out. They are meant to get bigger. Penetration is biologically designed to be in a vaginal opening. It is not biologically designed to be in an anal opening. Anal openings don't open that big. They're not meant to. And so anal sex is known to transmit HIV more because the anal opening tends to tear when it is being penetrated. So there are micro tears that open small little cuts in the anal opening, which opens that person up to infection more than penile vaginal sex. All right? So anal sex in general is more likely to cause the transmission of HIV, and men who have sex with men are more likely to have anal sex than heterosexual sex. Okay? Sorry, we had to talk about it. The other way that it is most likely to be transmitted is through injection of drugs. So especially using dirty needles, or needles that a person has used before, right? That's a way, sharing needles, that's a way of taking blood directly from one person and injecting it into another, is through injection of drugs. It used to be transmitted before it was very well known. So HIV first became very widespread and well known in the 1980s, which is not very long ago, right? I know it seems like a long time ago to you, but I was born in the 1980s. Wasn't that long ago. Before that, people didn't know what it was, and it became a huge epidemic in the 1980s. And before it was really known what it was, you could get HIV from blood transfusions. Now that can still happen, but most blood products these days are tested extensively for HIV before they are put in somebody else. But you can also transmit HIV vertically, which means from mother to infant, either through childbirth or through breast milk. Okay, but it's usually transmitted through, the most common ways that it is transmitted in both males and females is sexual contact, with injection drug use coming in next. Okay. And as far as treatment for AIDS, there is currently no cure for HIV or AIDS. Nothing that you can take is going to, as far as I know, I think that there have been some cases of like 2 kids being cured of AIDS, but they were treated, like their mothers had HIV, and they were treated like as soon as they were born, so the virus hadn't like taken up residence as much. I don't think that there's anybody who has been in, like an adult that has like in the center of their HIV infection been cured, as far as I know. But as of right now, there is no cure for HIV, but there are a lot of drugs that have been developed in the last 10 or 20 years that are called antiviral drugs that greatly extend the lifespan of a person who has HIV. And then there's also a set of drugs called PrEP, and PrEP is a drug and a set of drugs that can be taken by people at risk for getting HIV, like somebody having sex regularly with an infected partner. You can take PrEP and it will prevent you from getting HIV in the first place. It doesn't cure it, but it showed to significantly decrease the rate of infection. Okay, and PrEP stands for pre-exposure prophylaxis. So you take it before you are going to have sex with somebody who has been known to be infected with HIV, or if you're having sex with somebody whose HIV status is unknown, you're having sex with somebody you don't know, you can take PrEP, and it will prevent you, ideally, from getting HIV in the first place. So living with HIV is a lot different than it was 20 years ago, 30 years ago, 40 years ago. The lifespan is a lot longer, and there are much better ways to protect yourself from getting HIV and extending your life even after you get it. There was a long time in the 80s and 90s where HIV was a death sentence, and you knew that you were going to die within 2 or 3 years. It was a really, really scary time. If you watch old episodes of medical shows like ER, if you ever go back and watch ER, there's a lot of talk and stigma and things like that surrounding HIV. All right, our next one is called infectious mononucleosis. This is commonly known as mono, and you may have heard of this one. This one is relatively common, especially in young adults, because mono is also kind of colloquially known as the kissing disease, because it is spread through body fluids like saliva, blood, semen, but it can be spread through saliva, right? HIV cannot be spread through saliva. And so you can get mono from kissing somebody. It's kind of commonly called the kissing disease. And the causative organism of this is Epstein-Barr virus, which is a virus. And the kind of characteristic symptoms of infectious mono, or mono, is fever, swollen lymph nodes, but the big one is the enlarged spleen. So your spleen is an organ, And this just shows it getting bigger. But your spleen just gets swollen. And so you can have lots and lots of pain where your spleen is in your torso. It gets infected and swollen. And the other kind of hallmark symptom of infectious mono is extreme fatigue. So people who have mono will sleep for days and days and days, and they feel like they can't get out of bed for weeks at a time. And a lot of times the fatigue will continue on. I had mono when I was like 13, and I did not get it from kissing a boy, but I had mono when I was like 13, and I thought I was dying. But like I went to the doctor, and they're, yeah, you have mono, and nothing really bad happens. You just feel like you can't drag your body out of bed. Like I've never known fatigue like that, and I've been pregnant before. It was just the kind of fatigue that you feel like your body is not going to move. Like you can't make your body move. And that fatigue is known, again, to last for really long periods of time. Transmission is direct and indirect contact with body fluids. Again, this one can be transmitted through saliva. It can be transmitted through other ones, but saliva is the most common. Treatment for it, there's not really treatment or a cure for it. It's one of those things that you take supportive care. You know, if you have a fever, you can take ibuprofen, lots of fluids to make your body feel good, get lots of sleep, but there's not really any treatment or cure for it. And mono usually goes away. It's just one of those viral illnesses that you have to see out. All right, and then our last one in this chapter, we are going to continue on to chapter 20. I'm sorry. I want to get through as much of it as possible. Our last one in this chapter is malaria. And malaria is not caused by a bacteria or a virus. It's actually caused by a eukaryote, which is, it is a protist. And if you don't remember all the way back from when we talked about this, the eukaryotes are broken into several different categories. You have plants, animals, funguses, and then you have protists. And protists are just a group of eukaryotes that are not plants, animals, or funguses. Okay. But malaria is caused by a protist. It's a eukaryotic organism. Okay, but it's not a plant, animal, or fungus. It's a eukaryotic organism. And the causative organisms of malaria are Plasmodium species. And we're not going to talk about the different species. All you have to know is the genus. It's caused by Plasmodium species. And the signs and symptoms of malaria, early signs and symptoms are fever and weakness. But again, those are true of a lot of diseases. Kind of the hallmark is the hemolytic anemia. So the way that malaria works, and you can kind of see it on this picture here, all of these little red circles are red blood cells. So this is a picture of somebody's blood that has been put on a slide and stained with different colors. And a normal red blood cell looks like these guys over here. This is a normal one. Okay, they're like this reddish kind of pink, dusty rose color, right? All of these little ring-looking things, all of these purple rings are malaria. So that is the malaria. It's the protist, and it grows inside of human red blood cells. So it grows inside of those red blood cells, and eventually the red blood cell will burst. Well, a person who is infected with malaria, eventually enough of their red blood cells will burst open that they will have anemia, which means that they don't have enough red blood cells. Okay, we call it a hemolytic anemia because the red blood cells are bursting. Hemo means blood, lytic means bursting open, so hemolytic anemia. Eventually, enough of the red blood cells break that there is not enough red blood cells for their body to carry enough oxygen. And that hemolytic anemia will eventually lead, again, because your body is not getting enough blood, your organs will eventually fail. And malaria is a significant cause of death, even still to this day. It's estimated that about 600,000 people die of malaria every year. This is another one of those diseases, though, that we don't get in the US very often, and so we tend not to think about it. Because that's just the nature of who we are, right? That's just what we do. For good or for bad, it's just what we do as people. And we tend to focus on the things that are threats to us around us. We tend to forget about the things that are threats to other people. Sometimes I think we do it out of our own self-preservation, right? That if we thought about all the threats in the world, we'd just die of an existential crisis. But malaria is a significant cause of death in the world, and it has been for a very, very long time. And most of the people who die of malaria each year are children. And malaria is spread through vector transmission through mosquitoes, again. So through mosquito bites. Somebody with malaria, or a mosquito bites somebody who is infected with malaria, and that transmits to somebody who doesn't have malaria. And again, malaria is a very significant cause of death worldwide. And it's still true to this day that the best way of treating or preventing malaria is to prevent you from getting it in the first place, usually with mosquito nets. So mosquito nets and mosquito control, so killing the mosquito population and preventing people from getting bitten by mosquitoes, remain the best treatments for malaria. So treatment for malaria is really, really difficult. Again, because it's a eukaryote and it lives inside of our blood cells. So how are we supposed to treat it? Anything that is going to kill that protist is going to kill our red blood cells. We're going to be in the same problem. So most treatments for malaria don't work very well. There's not currently a vaccine that's available. And even people, most of the time, again, it's the same case, malaria is most common in areas of the world that don't have great health care. And so even if there was a good treatment for malaria or a vaccine for malaria, the people who need it can't afford it and they can't get it. So the best treatment and prevention, the best treatment for malaria is the prevention of it. Mosquito nets and things like that. There are anti-malarial drugs that do exist. They're expensive and they don't typically work very well, but they do exist. All right. So that should be the last one in this chapter. Like I said, we are moving on to chapter 20. I want to try to get through as much of this as possible today, and that will make the video that you have to watch shorter. Okay. I know that's not fun, but. So we're moving on to chapter 20, which is infectious diseases affecting the gastrointestinal tract. Now again, we will cover chapter 19. I'm just skipping it for now. We'll cover chapter 19 on Monday. I wanted to do this one because this is a relatively short chapter, and so I want to decrease the amount of recorded time. So, anatomy of our gastrointestinal tract. I think we've talked about this before, that human beings are basically a giant chunk of meat with a tube going through it. And the tube going through it is your gastrointestinal tract, right? It starts at your mouth, it goes down your trachea, into your stomach, through your small intestine, through your large intestines, and then out your anal opening. Okay, so we're just a big chunk of tissue with a giant tube through it. Okay, so your gastrointestinal tract includes anything it can include your mouth as well, parts of your mouth, your trachea, the stomach, the large intestine, the gallbladder, the liver. All of these organs, the liver, gallbladder, and pancreas, we're not going to talk about their specific roles in the human body. You can talk about that in anatomy. But the liver, gallbladder, and pancreas are all involved in digestion. Not going to talk about their individual roles, but they play large roles in digestion, in digesting food. Okay. And that's what the whole GI system is for. It is for digesting and absorbing nutrients. And the GI system, particularly your large and your small intestine, has more normal flora than any other area of your body. Your entire GI tract, specifically your large intestine and your small intestine, are just chock full of bacteria. And we've talked about before how the gut microbiome in particular, in recent years, has been attached to so many different things. It's thought that autism can be linked to the gut microbiome. Like your heart problems can be linked to your gut microbiome. Alzheimer's, all kinds of stuff is coming out. That your gut microbiome is a huge part of your health. So their GI tract has lots and lots of normal flora in it. Okay? And this is just a little infographic to show you the top 5 causes of foodborne illnesses, because most of the infections that occur in the gastrointestinal tract is going to come from our food. Not all of it, but a lot of it. And the first one, the most common cause of foodborne illness in the world, or I guess this is in the US, but I would say it's pretty worldwide, is norovirus. By far, more people get norovirus than any other type of GI illness. And the reason for that is because norovirus is highly contagious, and norovirus is actually not killed by hand sanitizer. So if somebody in your house has norovirus, hand sanitizing isn't gonna do nothing. You have to wash your hands. This is like where you have to wash your hands with soap for a solid minute to even have a chance of clearing off norovirus. Norovirus is very hardy. It's not killed by alcohols. It is killed by bleach. So if anybody in your house ever has norovirus, hand sanitizer is not going to do nothing. You got to use lots and lots of soap and bleach. Okay, and then there are some other ones. We're going to talk about a few of these. And then the top 5 causes of death from foodborne illness. The top one is salmonella. And we'll talk about salmonella in just a minute. All right, so this is, I usually try to avoid things like this. I don't like the idea of a giant chart that we're gonna look at, but I figured that this was preferable to lots and lots of pictures of diarrhea, because that's all we got, right? Other than, all of these illnesses are diarrheal illnesses. So they all cause different forms of acute diarrhea. They come from different places. And so the best way I could think to do this was just to put it all in a big old chart, which again is not the kind of thing I usually like to do. You're not usually supposed to do that on lecture slides, but there was only so many pictures I could put up of somebody in a bathroom. I don't know. All right, so we're gonna go through these. Again, this is a big chart. I'm going to point out the characteristics of each illness that you have to remember. Okay, so the part that I talk about is the thing that you should remember. Okay. Now our first one, the disease is called gastroenteritis, right? And that just means inflammation of your gastrointestinal tract. And the pathogen for that is Campylobacter jejuni. Now Campylobacter jejuni causes fever, diarrhea, cramps, vomiting. We're gonna see that a lot, right? Fever, diarrhea, cramps, vomiting. Those are symptoms of a lot of these. The thing to remember about Campylobacter is Campylobacter is particularly associated with farm animals. And Campylobacter in particular is transmitted through the ingestion of raw milk or raw food products associated with farm animals. So it can also be contaminated water if you're on a farm and there's a cow pooping in the water source. You can also get Campylobacter that way. Campylobacter lives in the gastrointestinal tracts of farm animals. So raw milk, water contaminated with farm animal poop, things like that, that is where you're gonna get it. But most sources of Campylobacter come from raw milk or raw dairy products or products from a farm that have not been processed properly, haven't been cooked, things like that. So again, that's the big one, is that Campylobacter is associated with raw milk and farm animals. Right. Our next disease is called cholera, and this one's nice and easy because the bacteria that causes it is Vibrio cholera. Now, Vibrio cholera is mostly transmitted through contaminated food, especially shellfish, so especially raw shellfish. So it's spread mostly these days through raw oysters or undercooked crawfish, things like that. Any seafood that you eat raw, sushi, stuff like that. Especially seafood and things like that that come from warmer waters. So like crawfish that comes from the Gulf of Mexico, it's warm down there. Okay, the Gulf of Mexico is very warm compared to like the east or west coast. And so shellfish is where cholera comes from. And the kind of hallmark characteristic of Vibrio cholera, or the disease cholera, is this severe, severe, severe diarrhea and fluid loss. The diarrhea that is associated with, and I know it's gross, nobody likes to talk about it, but cholera, the stool that comes out of a person with cholera, nobody wants to admit it, we've all had diarrhea before. But usually when you have diarrhea, it's still the color of poop, right? It still looks like poop, it's just watery, right? Cholera diarrhea is so severe that the stool is given the term, it looks like rice water. So if you've ever cooked rice, when you wash rice and the water is kind of cloudy when you're washing rice, that's what the poop looks like in somebody who has cholera. So it has no color to it. A person who has cholera is losing water so fast that their stool is basically straight water. Okay, and that's because the bacteria attacks the intestinal lining and makes it shoot out all of its water. Okay, so it's in rapid fluid loss. Well, cholera used to be a major cause of death. I know you guys are a little bit young for it, but I used to play the Oregon Trail all the time, and half your people died of cholera. Right? They all died of cholera when you played Oregon Trail. It was Oregon Failure. You always lost. Oregon Trail. And it's because that's severe fluid loss. If you don't have supportive care, most people who get cholera these days need IV fluid replacement and things like that to get through it. Okay. All right. And then we kind of already have talked about C. diff before, right? It causes pseudomembranous colitis. And that's C. diff. That's the one that's associated with antibiotic use in the hospital, the one that's treated with fecal transplants, right? When the microbiome in the gut gets destroyed because of long-term antibiotic use, C. diff can kind of take over. All right. And I guess we'll stop there for now. And the rest of this I will record in a lecture, and I will post this weekend as soon as I record it. It's probably not going to be tonight because it's Halloween. I got stuff to do. Thanks. Happy Halloween to you guys too. But I will post it sometime this weekend, and I will send out an email when I post it.